Okay, first of all, thank you very much for receiving us. And I would like if you can tell us your name and your position here.
I'm Nancy Lashide, and my husband and I co-founded the Neighborhood Health Clinic.
Okay. What can you tell us a little bit about this place, this clinic? How was it born?
It's great. It was an idea that we had after coming to Southwest Florida and understanding the scope of poverty in the community and the lack of a medical home for low-income workers. We looked around the country at other clinics, charity clinics, with the idea that maybe we should do something, but what would we do? So as we gathered information and data, we realized that we had an idea. And to be quite honest with you, retrospectively, we now can tell you that we were called to do this.
Why do you think that?
Because there was a need, we had the skill, and we had the passion.
And what make you, I mean, this is an adventure, it's very hard to build it. What made you do it?
Well, first of all, need. That was it. The scope of poverty in Collier County and the types of jobs that were necessary to improve the quality of life for other people who were residents here, we realized that they were being neglected and that it was important that somebody step up and take some responsibility to try to help them. We did not do it serendipitously. We did not do it without doing our research, and we felt that we had a good idea and that there was a need and we needed to step forward. There were a lot of surprises. One of them, and probably the first and most profound surprise, was how severely ill our patients were, and yet they were still being productive, going to work every day, taking care of their families. But the other surprise was the compassion of the community. I can remember Bill and I laughing to each other about how we were marching down a road that was unfamiliar to us, but we had the passion to do it. And every now and then we'd look over our shoulder and say, they're following us. People are believing in this. They like the idea. And so we have to keep walking, and we have to keep walking faster.
And what can you tell me a little bit, one little thing about those days, about that energy, about that dream?
Yeah, scary.
It was, right?
It was very scary. You know, it's one thing to say to people, we've got this really good idea. Let's do this together. And then it's another thing to take it to the next level. You know, the hardest thing, it's not difficult to motivate and to encourage and to explain and to explore. It is extremely difficult to sustain. That's the challenge. And I tell you that sitting here 18 years after we started it, so that should illustrate to you the degree of energy and time that went into it. But more importantly, this clinic is, number one, primarily about the patient, and number two, it's about the community, and it works for us.
What it was like 18 years ago? Right now it's a huge, lovely building, and what it was like back then?
We were blessed to have the local not-for-profit hospital let us use 3 rooms that were in a strip mall that they had on the market to sale, and it was primarily abandoned. And we were there by ourselves, the 3 rooms. It was Bill, my husband, myself, 1 volunteer, and the first night we had 8 patients. The most profound case was the first case that came through the door.
What was it?
His name was David. And the 3 rooms that we had in the mall were adjacent to a small restaurant. We had gone around town and put posters up in gas stations and 7-Elevens, that sort of thing. But we really weren't sure who was going to come. The first night we opened, David came through the door. David was a dishwasher. David and his brothers and sisters had been put in an orphanage. The other children had been adopted or put in foster care, but David had polio, and therefore he was not chosen. When he aged out, he hit the road, and he probably hit every bump in the road. By the time he came to us, he was working as a dishwasher, as I said. He had post-polio syndrome. And after we investigated his health, we realized that he had a lot of chronic diseases that he had inherited, such as diabetes. But we had no history on him because he'd been in an orphanage. We drove home that night and sat in the garage in our car, and I cried because I had a profound understanding of where we were going to be going down this road. Profound.
And can you tell us how did you change the life of this guy?
Oh, David. David, I must tell you now, is gone. He did not last many years. We took care of him throughout his short life. I like to think of him in a positive way, and one of the things was Christmas, and he was in the hospital. We had him admitted for a number of reasons, and we bought a shirt, and Bill went to the flea market and bought a watch, and we had a few things that we wrapped up, and we took over those for him, and with the intent of just giving him his gifts, hugging him a little bit, and leaving. When we got there, there was another one of our volunteers there with his two sons who had done the same thing. And suddenly it became evident that we here, we had taken the place of the family for him. It was his first Christmas with gifts.
Do you remember how did he told you, like, thanks?
Well, he wasn't very demonstrative. And he was, initially he was a little embarrassed. Then he sort of got with the program, and we all laughed and talked. And there's no question in my mind that we were at the right place at the right time, and we did the right thing for David, and David loved us, and he knew we loved him. But you know, we fall in love with a lot of our patients. You know, we really do.
What motivates you?
What motivates me? God.
Every day.
God motivates me. And I believe in our mission. And when things are bearing down on me, last night was tough here at the clinic. We had a lot of difficult patients, a lot of difficult situations. And when I'm really struggling, I walk into the waiting room. I like to see the faces. Often they're tired. They don't smell very good. They're dirty. But we're their family, and we're going to be here for them.
That's amazing.
I love what we do.
I know that you don't have to be here because you could have been like retired, right?
Right.
It's not a question of age. It's just
No.
a question of, you could have chosen not being here. So why you come every day here?
Because they need us. Why wouldn't I? This is why I'm here.
So when you look a little bit back and you figured out what you had and what you accomplished, what do you think?
Let me tell you what makes me sad, and then let me tell you what makes me happy.
Okay.
What makes me sad is the commitment to this was so intense and so time-consuming, and all-encompassing that I missed birthdays, I missed graduations, I missed growing up experiences with my grandchildren. We made an effort to do what we could, but it always fell short because this was so demanding. That makes me sad. What makes me happy is that it works for the people who need us, and it's going to go on. There's no question in my mind, none whatsoever, that this is forever.
So do you think this is your legacy, as your personal footprint in this world, in this life?
I believe I believe two things. I believe that it's the legacy of our family's mission, inclusive of our children and my husband. Our family's committed to this. Our daughter is committed to this. She left a lucrative profession to come here to carry on the legacy of the mission. But I think the big legacy is the credibility to this community and the respect they have for low-income workers.
There's a time in our lives that we need to stop everything and we need to say thanks. Who would you say thanks to?
Thank you to the patients for giving us the privilege of being partners in their health care. Thank you for the community for believing in the mission. And thank you for my family for being tolerant of the amount of time we've committed to this mission.
Do you ever imagine yourself here doing this?
When I was growing up
Right,
in
yeah,
my
like a-
career,
like a
never,
teenager, like a-
never. Which, and you know, let me tell you, that's why I know it's a calling. You know, this was not on my agenda. You know, it's almost like you want to look at God and say, really? This isn't what I had in mind, God. And here we are.
And how do you think you bump into it? Or how do you think you just came at the path that sometimes we don't choose it and just it's over there and you have to walk over it? How do you think, what was those signs that told you that?
Probably the signs were the patients that the two of us were seeing in private practice and understanding how scared they were about how they were going to continue to do this. You know, I don't want their jobs, but I'm going to help them do their jobs.
What do you think about diversity? What can you tell us about diversity here in South Florida?
Well, we have 43 countries of origin represented in this clinic. We've identified that. From a very technical medical standpoint, that's exciting because it's giving us opportunities to see illnesses and diseases that we wouldn't have seen before and to treat it effectively. Diversity, I'm sorry, but I don't see color or ethnicity. I just don't see it. You're sick, you're tired, you have a job, you need help, you're going to get it here.
What can you tell us about a little bit about your specialty as a physician?
I'm not a physician, I'm a nurse, and my husband was a physician.
Can we do the last question again?
Can we do what?
The last-
Please don't tell me we're going to start over again.
It wasn't the final cut.
Oh.
This was a testing.
Oh!
This was an audio testing. Did I tell you?
No, and we're all going to have dinner together, and then we're going to have breakfast. And okay, what are we doing? What am I moving too much?
No, it's about you're doing perfectly.
Thank you. You know, I really, the diversity thing is just an.
But it's a question, you know.
I know it's a
Even
question.
though it doesn't supposed to be there, it's there. It's hard to put it in words, but diversity is the norm for me. But
I think, okay, I can take this. Okay, I'm ready.
We're ready.
We're ready, go. Probably the diversity issue is the excitement of what we learn about the cultures. For example, in this level of poverty, and I'm not talking about the diversity in the generic way that people would, I'm now talking about wealth, moderate levels of income, and poverty. there's an interesting thing that I read one time. Wealthy people look at food for the way it's presented. Mid-level people look at food for the way it tastes. Poor people look at food if there's enough. So knowing that to be a fact, when we educate our patients here at the clinic, and we have a number of educational programs, we have found that the way to motivate them is to supply food. Cookies and iced tea, cook their lunch in front of them, we all sit and we eat together. When you sit down to eat together, where's the diversity? I mean, you've got two hands and a mouth. What more do you need, right? But I've learned from their culture. I know about their folklore. I know about burying a chicken foot. I know about using Vaseline on your feet. I know all of these things that are part of their culture. That's the kind of diversity I know. I don't care about the diversity of skin color or accents. I really don't care.
Do you have any challenges?
There isn't enough time in the day. There aren't enough days in the week, and I don't have enough years left. So I have to continue to do what I'm doing, and I have to trust the people to whom I work with, in particular my daughter who works here, to tell me when it's time to move on.
What do you like the most about what you created?
People. I like the patients. I like the volunteers. I like the staff. We're all here for the same reason. There's no agenda. There's no personal idea. It's just to be all here together doing good work. You want to start volunteering? Have I persuaded you yet? How about you?
Do you mind if I use that for the end of the package?
What?
That phrase, that lovely phrase. Do you want to be a volunteer? Thank you very much.
My pleasure.
Just
Thank
stay
you.
there a little bit. We're going to do some B-roll, right?
Yeah, okay.
We're going to do, we are not going to keep on recording
Okay.
on voice, but we are going to keep on doing some B-roll about,
Okay, let's go.
Cuando diga.
Let's go.
Vamos?
Vamos.
Well, first of all, thank you for receiving us today. I would like to, if you can tell us your name and your position here.
My name is Leslie Lascheid, and I am the CEO of the Neighborhood Health Clinic.
For how long have you been working?
I've been here a little over 4 years. It's been a wonderful 4 years, yes.
What can you tell us about it?
I moved here in September 4 years ago, and the community, I vacationed here but not lived here, which I think a lot of people have, so it's different when you live here, and it's wonderful. I never expected to come here. It wasn't in my plan. My parents had started a clinic 18 years ago, and I always helped behind the scenes. But continued with my career and my family, and on vacation we'd come down and help. I wrote a lot of the policies and procedures that went with the clinic as it was growing. And then 4.5 years ago, 5 years ago, the board had a search committee looking for someone to move from executive director to a CEO type position as the clinic has grown over the years, and they were looking for somebody to put some infrastructure in and make some changes to keep it moving forward at the fast pace that it was. And they approached me. At the time, I had children still in college and single parent, so a lot of expenses, and I couldn't make a change. I was sort of what I would consider at the peak of my career. So I thought long and hard, but passed on taking the position the first year. The second year, they came back and they said that, again, that they needed to do a search, and would I consider it? At the time, I came back to visit and said I would do some consulting and some help, help them out, which I did. And while I was here, my dad's health started to fail. And he said to me, I'm not part of the search committee or, have any involvement in that today. But he said, I need you. And he said, I need you to come. And, when Dad asks, I knew it was serious. So I came. I explained to the board, and they were very kind, that I felt a little bit like a fish out of water, that I had never been in nonprofit or in medical. So I was concerned, was I the right person? And I have to tell you, the first time I walked into clinic and the patients were there, and I don't know that I ever understood what we really did. Even though I wrote some of the policies and procedures and I was involved at my parents' level from afar, I don't think anybody has any idea of what actually happens here unless you're here. And that's why you see volunteers that have been here for the entire time, or for 15 years. Because once you come and you understand the magnitude of what happens here, it is amazing. So by the time I get maybe frustrated or caught up in the day-to-day activities, all I need to do is walk out there and look at a patient's face who will hug me, kiss me, thank me, and I thank them. It is a wonderful place.
What really happens here?
Not what I thought. I thought of it as a medical clinic that sort of you came in and you had an episodic incident and we put a Band-Aid on it and you went on your way. Because of the way we are here, we Americans now, or people in the United States, have 3 to 5 chronic diseases. So our patients are people that have been chronically ill for years but have no access to health care for a lot of different reasons. And so by them coming here, they need to be educated on their illness, and they get everything they need when they come here. So they get all the tests, all the surgeries, and they leave here with every bit of medication. So we actually help them manage, and we coordinate their care for this chronic illness that they have. And it's just amazing. If health care in America could be what we do here, we would all be okay.
So how this is possible?
It's possible because the individuals, the medical community, the volunteers, the donors, they understand the mission and they understand what needs to happen. The mission statement, if you look at it, has been held true since the beginning, and it is a wonderful mission statement that says that this clinic will take care of the working, uninsured, low income by volunteerism and private philanthropy. So we don't take government money anyway, and it's all done by volunteers. So 247 volunteer doctors, 40 to 50 volunteer dentists, well over 100 volunteer nurses, plus all the supportive staff and everybody else that needs to help. And we have 11 full-time people that are paid. Everybody else is volunteered.
Can you repeat those numbers though? It's a kind of a miracle.
It is unbelievable. And I think, a couple of our physicians, our doctors, and I'll just use Dr. Paul Jones as an example, will tell you this is why he went into medicine. He went into medicine so that he could come take care of people. But in their private practice, so often they end up with a lot of bureaucracy, a lot of paperwork, a lot of insurance, a lot of regulations, things they're supposed to do and not do, just because the law requires it. At the Neighborhood Health Clinic, because we don't take government money and we fall under a 501c3 and sovereign immunity for the state of Florida, we're able to take care of people the way the physicians need to take care of them.
Who can come here?
If you are working, and you have to work a minimum of 80 hours in the last 30 days, and you have to have no other access to health insurance, and you're at 200% of poverty or below for your family, So that is a lot of working people. So as we like to say is that these are people that are choosing work over welfare. So they're working in the lowest paying jobs. And you sort of say, how does that happen? These are the service industry jobs. For whatever reason, we value those jobs greatly, but yet pay very little. So if you think about our patients are people that take care of our parents, take care of our children, take care of us in restaurants and hotels. They may clean your home, they may cut your grass, clean your swimming pool. They work at maybe the country club you belong to. These are hardworking people, but we as a society have them as the lowest paying positions.
So you have said like a most important statement. They are choosing low income before welfare. I mean, I think that is incredible.
That is I think that's everything. Someone said to me a while ago, and this is, I think right when I first started, what do you do when someone becomes unemployed and now you have a sick person that you're taking care of as unemployed? And I said, our people aren't unemployed. If they lose a job or a job stops or they can't get enough hours, they take the next job. They take any job. So it's not like some people where they're like, well, that's not the job I'd like to do, or that's not really what I thought I was going to do in my career. These are people who take a job to put food on the table. They're holding their family together and they're going to do any job. It is just amazing to me. So why wouldn't you take care of people that all they want to do is put food on their table and bring their family up the way that they would like that to be done?
When I first heard about this place, I couldn't believe it was, like this, because it is almost impossible to get up a clinic with these, characteristics, and all the physicians and dentists to the public without, how this is possible, even though there's got to be times that are very rough, because one thing is the idea, the other thing is what you want to, but another thing is the fact that you need medicines, drugs, tables, places to sit. How this is possible?
As my mother said, God lives here, and no matter what your religious background or thing, they, for the years before I came, always would do it that if they needed something, it always came. And the board knew that as it continued to grow and we needed to offer more services for the patients, that we needed a little more structure in it than that. But that is how it is that the doctors come, I think originally because they knew my parents and they believed in the mission. Now they come because they recognize the work that they're doing and they can see the difference in these people and how somebody's life is either, the quality of life is better, maybe they've lived longer. The life expectancy of a lot of our patients is not as great as years of mine because they've lived years with poor health. So when people come here and they understand that these are hardworking people, these are family people that are trying to do the right thing in life, that I think people jump on board. My father, growing up, my dad had sayings, and he always had these great sayings. And this one hit home more now than probably in all my years, which is he would say, do the right thing. And then he'd pause and he'd say, but make sure if you're going to do it right. And that's what we do here. We don't just do the right thing, which is take care of working poor people. We do it right. We give them the best medicine. And I think when you come in here to volunteer, or our donors, it's amazing who our donors are, local people, they understand that we're doing the right thing here, we're doing it the right way, and we're all working together. So this is definitely a community who's decided to take care of a community.
How do you remember the work of your father?
Naturally, being the oldest daughter, I remember my dad as my hero. I think like any daughter would. Loved my dad more than I could ever tell anybody or express. He was a great man, small in stature, soft-spoken, and had a heart of gold. And he knew the idea of hardworking people. He understood people who chose to work and work that hard, and he wanted to make sure that they were taken care of. My father was brilliant, but you wouldn't know it and he wouldn't tell you. Youngest person in his, to have gone to Pitt Med School, entered before he hit 19 years old, and dedicated his life to taking care of people. He didn't care who you were. The idea was that you needed help. So he never judged anybody. He never looked at everybody was, what is not feeling well? What can I do to help you? And that's just the kind of person he was. He was very smart. Dr. Bob Tober, who heads up our emergency medicine and is here at the clinic as our medical director, used to say that he was the most brilliant doctor he had ever met. And I believe that's true. I don't think that Dr. Tober would say that. I had a patient, we have a patient here, a very nice young man, I'm going to say early to mid-30s, Eduardo. And Eduardo is this wonderful man who has a bad illness, and it affects his kidneys. There's no cure for it. There's nothing to do. But his life is you know, we're maintaining where he is and how he is, and he's able to work every day. And one time he was here, and he had to go to the emergency room because we couldn't do anything more here. And you have to be pretty sick for us to determine you're going to the emergency room because of unbelievable medicine we practice here. But he wasn't sick enough to go by ambulance, so I put him in my car to drive him over. And he was sitting there, and my dad had just passed a couple months before then. And so Eduardo was sitting next to me, and he's very quiet, and he said to me, "I know your father's in heaven." I said, "Yes." And he said, "He's not sitting in a chair in heaven." He said, "Your parents will not have a chair in heaven." And I said, "Oh." And he said, "They will have gold thrones." And I said, "Thank you. Thank you so much." And that's how the patients react to the medicine they get here and the help they get here and the hugs that they get here. But that's why we're all here. And when you see somebody, and you can see the faces around the room here, when you see those faces and those people say, you know, I was able to take care of my children, I was able to, you know, we hear stories of now those parents, maybe their children got into college, and maybe nobody in their families got into college, or graduated high school. That a lot of it has to do with that we were able to make them feel well enough to continue to work.
It has got to be real hard for you as a daughter to be able to go up these beautiful and lovely laurels that you got, right?
Mm-hmm.
Because I mean, it has got to be very difficult for you to, you know, to not to compare, but you know, to keep up their pace and their spirit and their strength, right?
I think I always saw it as, I always thought of my parents as great people, I think as any daughter would. And I think that I've never, because my parents, especially my father, very low-key and very quiet. My mother's, somebody asked me one time, how did your parents, 6 children? And I said, my mother was never in the armed forces, but you would believe she was, because there was a military way of we did everything, which was wonderful. But my parents never, it wasn't about them. It's never been about them. So everything they've done is that it's the clinic, and it's organizing everybody and bringing everybody together as a community to take care of it. So on one hand, yes, I see my parents as great people, but I've never felt that I've needed to measure up to anything, because they've always just been so proud of who we are and what we're doing. My entire life has been always about giving back to the community. As a family, it was our way of life. It was nothing that on, you know, Thanksgiving Day as a child, we would all get in the car and go to maybe the local nursing home and visit families, people that didn't have families. Go to a homeless shelter and play our instruments. You know,
What
I
do you
mean,
play?
the flute, and not well, never well, but and I'm sure those people were pleased when I stopped playing the flute. But
You're so modest.
but
You're so
so
modest.
we would. But it was sort of. My dad would always say the community has been good to us.
What community was back then?
It was up in Pennsylvania, a community called Sewickley, and he said, "The community's been good to us. It's your obligation to give back to the community."
Tell me a little bit about this young lady that works every day with you as your mother.
Unbelievable. Yeah, she is unbelievable. She's everything. She's the clinic. She has this insight and forward thinking that I can't explain. I come from business background, and so strategy and planning sort of what I do. She does it naturally. So all my education helped, but hers is natural. She knows what needs to happen. She knows what the patients need. Patient-driven, mission-driven, that's everything. And she keeps focused on that. We don't waver from that. You know, we do what we do best, take care of sick people. And she does that every single day. She knows what needs to happen, where we're going to get the resources, who's going to do it. You know, she's just an amazing person, the energy and the stamina and what to do.
And she keeps on working.
She keeps on working.
Where she gets those batteries?
I know. Is that true? That is true. Yes, she has always. She's always just been a hard worker. I think.
And when she feels that bad, she goes to the waiting room.
Right. Yes. Yes.
Is that?
Yep.
Is that right?
You know, growing up, family is Irish. My dad's part of his family is from Alsace-Lorraine, France, but they came over as like everybody else, as immigrants. The family did hardworking. So outside Pittsburgh, Pennsylvania, a lot of my relatives were police officers. Glass blowers in Ireland, and came over here looking for other work. Hardworking people. So I guess part of what's in our family is that this work ethic, and it's just that's why we're here. We're here to work, and whatever that skill is, or that trade is, or whatever you know you're called to do. That work ethic is in the family.
Who would you say thanks to?
Of course, I would say thanks to my parents, and I had the great fortune of being able to say that to my father before he passed. You know, I am very fortunate. I grew up with parents that provided everything I needed. I'm educated at the best schools. You know, I have everything, and I think that thanking the community and everybody else for you know allowing me to have that, and make sure that I pass that on. My 3 children all work in nonprofit now, and all came in different directions to get there. But I think there's just a clear understanding that we need to take care of people, and any way we can. So thanking the community, thanking everybody. I mean, it's amazing when I look at the doctors and nurses that are here. The donors, sometimes I'm amazed, especially in the first couple years, on who donates here. Again, we only do it by private philanthropy, so there's no other monies coming in. Our budget is $2.5 million each year we have to raise. We provide a 4-to-1, which means that for every $1 million in the budget, we provide over $4 million of services. Last year, not including medications, we distribute $4.5 million of retail value of medications each year. So last year, $16 million of services were provided. That takes these people and gives them health care and keeps them out of the emergency room and makes their quality of life better. But our donors, when you think about our patients, and if you look around at who our patients are, again, they're not the the little child's face, or the little kitten, or they're hardworking people. It's not a glamorous group. We're all in here, with our sleeves rolled up, working.
Are you completely aware what are you doing, the good things that you're doing, the great impact that you guys are doing in the community? Are you completely aware of that?
There's times that I'm oblivious to it, and we're just doing it. And then there's times that I'm so overwhelmed, in a wonderful overwhelmed, not a negative. I am overwhelmed about that we're holding some lives in our hands, and we're able to make those lives better. And that is just unbelievable. We have some people that graduate from the clinic, and that means that their health has gotten to a point where they can work more hours, maybe get that assistant manager job, be able to get health insurance, and those are our success stories. Unfortunately, we have a lot of patients that the best for the success is that the quality of their life, and that, again, everything is donated, all the services. So it is a big deal when we've been able to get a patient into hospice. So if you can imagine the way a lot of poor people or low-income people pass away, it's not something you want to think about, very alone. But we have had opportunity to get people that, even though their lives are coming to the end, that it's able to do it with dignity. And that's been my parents' number one goal, is to treat everybody with dignity and bring as much to the table as we can.
Finally, how do you imagine yourself and this clinic in the next 15, 20 years?
Mm-hmm. I would love to say that if we could get health care here under control, that they wouldn't need us, because everybody would be taken care of. Unfortunately, I don't think that dream is going to come true. And we're seeing more people than we saw before. So it doesn't give me a great hope that we have the answer at this time. It's important to me that we take care of the patient's needs. So as their needs change or grow, we need to do that with them. So it's not about the quantity of patients we see, but the quality. So if we have somebody who is very sick with something that we can't figure out, or we need another diagnosis on, what are we missing and what do we need to get for them? And that is everything from, we've had patients with organ transplants to infectious diseases that have baffled many physicians, and getting the right people in here to see them in the right care for them. So in the next couple of years, I will dedicate my life to make sure that we're doing as much as we can possibly for the chronic illnesses of these people.
Thank you very much for your time.
Thank you very much.